Hello everyone. Today we're going to talk about general surgeries. Gastrointestinal tract problems are one of the common complaints of a large group of people that require their visit to the doctor, such as constipation and hemorrhoids, as well as fecal incontinence. These complaints may be simple and require only symptomatic treatment, and may also be a symptom of a serious illness that requires further examination and treatment. In this video, we will talk about some general surgery topics, and we will separate some of the previously mentioned diseases and how they can be diagnosed and treated. Our role today is to answer most of your questions regarding general surgery topics. Today we have Dr. Kim, who is the leading doctor at Ewha Seoul Hospital. He is going to discuss with us everything about general surgery topics from an experienced medical point of view. And before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Kim.
Hello.
Can you please introduce yourself to our viewers?
Yes, I am King Wong-ho, a surgeon and director of Cancer Center at Ewha Medical Center.
Dr. Kim, first question. So what is fecal incontinence and what causes it?
Fecal incontinence is a case where you can't control your stool and pee. From the degree to which the underwear has a slight stool, there are cases where the stool is made without even realizing it. The main cause is poor anal sphincter function. There are two reasons for the decline in function. First is that the sphincter itself is damaged and cannot function. And the second is that the sphincter is normal, but the nerves connected to the sphincter are damaged and cannot function. Mainly in Korea, older women often gave birth in the past and caused damage to the sphincter, muscles, and incontinence. As the aging society grows, the number of patients with incontinence increases. According to data from the Health Insurance Review and Assessment Service, the number of patients with incontinence was 5,000 in 2010, but doubled to 10,000 in 2017.
Yeah. So what are the usual signs of fecal incontinence and what are the methods of diagnosis?
Yes. As mentioned earlier, fecal incontinence can range from a slight stool in the underwear to stool without even realizing it. Several methods are needed to diagnose fecal incontinence. The simplest method is ultrasound to see the anus sphincter, an anus pressure test to check if the anus is properly pressurized, an EMG test to check if there is any nerve problem, and a pelvic MRI to see the sphincter shape. Diagnosis is made through these various methods.
So after diagnosis, what is the treatment for this disease?
To treat fecal incontinence, the simplest way is medication. There is a way to reduce bowel movement so that the stool does not come out well. And secondly, there is a drug treatment method that makes the stool hard. And there is a Kegel exercise method that allows you to strengthen your sphincter function on your own. It is a way to strengthen your muscles through exercise to tighten and relax the sphincter yourself. Surgical methods include sphincter plastic surgery to correct damaged sphincter, and nerve stimulation. When the function of the nerve and sphincter is completely degraded, there is a plastic surgery that makes artificial sphincter.
Dr. Kim, so moving to constipation, what is constipation?
Constipation has several symptoms. Patients complain of various symptoms such as, the stool is hard, and I've had a stool, but I want to have it again. If you pass stools only once or twice a week, it is judged as the most accurate symptom and is defined as constipation.
So what are the methods of treatment and prevention of constipation?
To prevent constipation, you should eat fiber-rich foods and drink more than 2 liters of water a day to prevent stools from becoming hard. If intestinal exercise is not active, stool cannot come out, So constipation can be prevented by promoting bowel movements through abdominal exercise. You need to take medication for treatment. If the stool is too hard, you can treat constipation by taking a medication that softens the stool, consumes a lot of moisture, and takes a drug that promotes bowel movement.
So the chronic constipation can it lead to hemorrhoids?
There are several causes of hemorrhoids. If the anal pressure rises, the blood vessels cannot rise properly, which can cause hemorrhoids can occur. Chronic constipation is the biggest cause of increasing anal pressure. If you sit in the bathroom for a long time due to the constipation and apply excessive force, hemorrhoids can occur due to increased anal pressure.
Can you tell us a little bit more about the methods of examination and then treatments of hemorrhoids?
In order to diagnose hemorrhoids, it can be seen with the naked eye. You can also put your hand in the anus and diagnose it through a rectal examination. To treat hemorrhoids, it is divided into several steps. Hemorrhoids are divided into first to fourth stages. Stage 1. Hemorrhoids are cases where only blood comes out, and stage 2 is where hemorrhoid tissue comes out of the anus and enters the anus by itself. The third stage does not enter the anus by itself after the hemorrhoid comes out, so the hemorrhoid tissue must be inserted by hand, and the fourth stage is a stage where the hemorrhoid tissue does not enter the anus even if the hand is used. Usually the first to second stages can be treated through sedentary bathing, constipation treatment through fecal, laxatives, and hemorrhoid ointment. However, in the case of the third to fourth stages, hemorrhoids must be resected to complete treatment.
So can hemorrhoids reoccur after the surgery?
Yes. Anus is round in shape. If hemorrhoids occur in several areas in the anus, they can occur again around them. Remove the most severe tissue. Even so, constipation or other causes can lead to hemorrhoids again. It is important to remove the cause because it can occur again if the cause is not removed even after surgery.
What are the methods of preventing hemorrhoids?
Constipation should be treated to prevent hemorrhoids. To treat constipation, consume a lot of fiber and water and prevent sitting in the bathroom for a long time. In order to prevent anus pressure from rising, you should simply have your time short in the bathroom. You should not read cell phones, magazines, or newspapers in the bathroom.
So constipation and hemorrhoids, can any of them turn into colon cancer?
Constipation, fecal incontinence, and hemorrhoids do not directly cause colon cancer. However, the main symptom of hemorrhoids is bleeding. The main symptom of constipation or fecal incontinence is when stool does not come out well and diarrhea occurs. And colorectal cancer also shows the same symptoms. There are patients who think it is constipation or hemorrhoids and do not visit the hospital when they have anal bleeding or poor stool. However, since this symptom may be a symptom of colorectal cancer, you should visit a hospital with caution for yourself for an examination when showing these symptoms. The treatment may be delayed due to late detection of colorectal cancer, which may be detected early.
Okay. So what are the symptoms of colon cancer then?
When you have colorectal cancer, you may have several symptoms. There are anal bleeding and poor stool that I mentioned earlier. Also, when there is cancer on the right, anemia symptoms appear. It is important to take a colon cancer test when anemia appears severely.
What are the methods of diagnosis and treatment of colon cancer?
There are several ways to diagnose colorectal cancer. The fecal self-destruction test, conducted by the National Cancer Screening Project in Korea, is the simplest method. The fecal self-destruction test is a test to check for blood in stool. For more accurate examination, there are colonoscopy colonization and abdominal CT methods. Recently, a method of detecting cancer cells in stool has been developed, and these methods are being implemented.
So robotic surgery is also performed for colon cancer?
Yes, it is. Robotic surgery can be performed in all cancer surgeries. It can be performed in breast cancer, sentimental, adenocarcinoma, gastric cancer, and colon cancer. Since it is expensive in terms of money, robotic surgery is performed only in necessary surgery. But there are many advantages when performing rectal cancer surgery. So it is performed in rectal cancer surgery.
So does it have advantages over normal surgery?
It cannot be compared to laparotomy. When comparing laparoscopic surgery and robotic surgery, this type of instrument is used when performing laparoscopic surgery. So this side is fixed and it is laparoscopic surgery that moves in this way. However, in the case of robotic surgery, joint movement is possible like human hands. Therefore, surgery in a narrow space has a greater advantage than laparoscopic surgery. In addition, even after a long operation, it is less tiring for humans to feel tired, so the operating professor can maintain good condition, so better results can be achieved.
Okay. So what is the success rate of colon cancer treatment?
In Korea, the survival rate of colon cancer is higher than in Europe and the United States. The general 5-year survival rate, colorectal cancer, is about 70%. Of course, there are differences depending on the base number, but the 5-year survival rate of stage 1 colorectal cancer is more than 90%, and the survival rate of stage 4 colorectal cancer that is metastasized to other organs is estimated to be around 5%, and overall it is about 70%.
So what are the ways to prevent colon cancer for average people?
There are several ways to prevent colorectal cancer. To sum up in 3 ways, the first is to undergo colonoscopy once every 5 years if you are over 50. A polyp can be found through examination and removed. Since polyps can develop into colon cancer can be prevented through polyps removal. Second, there is a diet that reduces meat intake by eating high-fiber foods. The third is regular exercise. You can prevent colon cancer by exercising at least 3 times a week and for 30 minutes or more to activate metabolism.
Okay. So, Dr. Kim, what's special about the Department of General Surgery here at Ewha Women's University?
Ewha Seoul Hospital Cancer Center conducts patient optimization treatment. Professors of surgery, gastroenterology, hematology, oncology, radiology, imaging, and pathology will hold meetings to discuss optimal treatments according to the patient's conditions. Radiation therapy sometimes treats first, and chemotherapy sometimes treats first. In particular, cancer centers are specialized in robotic surgery. In the past, cancer that was very close to the anus was removed from rectal cancer, but recently, surgery to preserve the anus is performed with robotic surgery with technology specialized in narrow spaces. Through this, patients do not suffer from lack of anus.
Thank you so much, Dr. Kim.
Yes, thank you.
So today we learned many things about general surgery topics, and the doctor explained in details everything related to some general surgery topics, such as hemorrhoids and colon cancer. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below, and we'll respond to you as soon as possible.